Morning coffee ushers in most new days for Amy Wyson. So does a question.
What my body's going to do on that day, what types of situations are going to come into my controlled environment.
Like an estimated 8 to 23 million Americans, Amy is fighting long COVID.
I'm almost 2 years into this.
Amy got the virus twice. First in July of 2020, then again that October. Each bout brought a battery of unique symptoms, from body aches to brain fog. But instead of getting better, her symptoms lingered and evolved.
I would brush my hair and it would fall out, almost like a chemo patient. You know, things just don't heal. My body's just not the same.
As her body grappled with fatigue,
I used to be really outgoing, and
Amy's mental health was eroding. She went on disability for 6 months. Depression replaced joy.
And I just burst into tears, and it's all downhill from there.
Anxiety replaced confidence.
Sometimes it feels like, for me anyway, I'm just dying on the inside.
And last fall, Amy actually tried to take her own life.
Thankfully, I didn't obviously carry it through, but I'm still terrified that I did that.
Amy sought help from Oregon Health and Science University's long COVID-19 program. And one aspect of it in particular, treatment for COVID-related mental health struggles.
The mental health aspects of this are very real. The thoughts of suicide are something that I am hearing about every day when I'm talking with my patients, unfortunately.
Dr. Jordan Anderson is a neuropsychiatrist in OHSU's long COVID program. When it comes to long COVID, he says people's inability to rebound physically can impact them mentally and emotionally, wreaking havoc on their home and work life.
This struggle adapting to their new limitations and sort of grieving their former life is leading to really profound depression and suicidal ideation.
Dr. Anderson says treating these mental health cases requires extra care.
Some of these medications can make their long COVID symptoms feel worse, and we have to be careful with that. And this is a new variable that we're not really used to dealing with in the mental health field.
It's all still so new. Dr. Anderson says that may be the most important point of all. He says these patients need and deserve empathy and validation. They're finding it through therapy and within OHSU's long hauler support groups.
We just know that we have this collective common disaster, and working with them and hearing their stories, it's like we're all telling the same thing, but none of us knew.
For Amy, it all points to a place where she can only hope to return to.
My friends now are like, "Where have you been?" And oh my gosh, we miss you so much. I'm like, I miss her too. I miss me too.
In Southwest Portland, Catherine Cook, KGW News.
And our thanks to her for sharing her story. If you are in a mental health crisis and need immediate help, you can call the Suicide Prevention Lifeline. That is the number on your screen, 1-800-273-8255 or 273-HELP. For more on OHSU's long COVID treatment program, be sure to check out Catherine's article that's up shortly at kgw.com.
What a powerful story.